I'm Allison.
I'm Rachel.
I'm Juhee.
And I'm Nandita.
We presented on December 4th, 2021 to our HOSA board in hopes of increasing oral health knowledge in our school.
There are so many different oral hygiene products on the market, but do people even know what they are preventing by using them and the extent to which we must practice good oral hygiene? Well, I'm going to be conducting a social experiment to find out. Hi there. Can you name 3 different types of oral health conditions?
I know cavities and and that's all I got.
And what about you, sir?
I think just cavities.
Cavities, tooth decay, and periodontitis.
Okay. And approximately when was the last time you brushed your teeth?
I'm not quite sure, but yesterday? Or maybe the day before?
Okay.
I ran out of toothpaste, so I'd say like last week. Brushing my teeth isn't a priority since I'm homeless.
Half an hour ago actually. I'm in my first trimester, so my dentist told me to brush my teeth really often.
Wow, of the 3 people I just talked to, only 1 practices good oral hygiene and knows more oral health conditions than just cavities. Now, why is this even a concerning problem? Well, let's learn about the consequences of neglecting oral hygiene.
Before we get into the consequences of improper oral health care, let's first establish what oral health is. The Department of Health and Human Services defines oral health, which includes the health of gums, teeth, and jawbone, as a mirror for general health and well-being. However, due to low awareness of its significance, oral health is often dismissed as a non-essential. This leads to negligence of good oral practices, such as the basics of brushing one's teeth. Not performing such a small task doesn't seem like it would have any greater aftermath than some bad breath, right? Well, our HOSA team will tell you differently.
When good oral health habits aren't practiced, the first signs are cavities and gum diseases. Cavities form as a result of infrequent brushing, drinking sugary liquids, frequent snacking, especially of carbohydrates, and bacteria in the mouth. Sugars and starches not cleaned off the teeth feeds bacteria, forming a sticky film known as plaque, which then hardens into tartar. Hardened tartar acts as a protective barrier for the bacteria, allowing it to break down the enamel or the outermost layer of teeth. Hardened tartar under the gum lines aggravates your gums, causing irritation and inflammation, known as gingivitis, and ongoing gingivitis will lead to periodontitis, which is the deeper inflammation of gums. And that can cause loss of tissue and bone, as well as ultimately loss of your teeth. While everyone should practice good oral health habits, certain lifestyles require additional care. Changing hormonal levels in pregnant women causes them to be more prone to cavities and periodontitis. In fact, the CDC estimates that 60 to 75% of all pregnant women have gingivitis. Left untreated, gingivitis will turn into periodontitis, which has been associated with poor birth outcomes. Mothers have to be extra vigilant with their oral hygiene because bacteria from their mouth can transmit to the baby's mouth through contact such as kissing or licking spoons. Early contact with these bacteria results in excessive early childhood cavities and dental problems. Children with mothers with untreated cavities and tooth decay are 3 times more likely to have cavities themselves.
Pregnancy isn't the only circumstance in which extra oral health attention is necessary. Smokers require additional care as well. This is because smoking increases the risk of gum disease. According to Better Health, smoking even less than 10 cigarettes a day increases the risk of periodontitis by 4 to 5 times. Smoking causes dental plaque and decreases the strength of the immune system, making it significantly more challenging to protect healthy gum as well as heal already damaged gum. Besides periodontal disease, smokers may also experience tooth loss, tooth decay, a harder recovery from mouth surgery, and more.
On the slippery slope of smoking, people may also develop oral cancers. According to Dr. Sashchev, 50,000 people are diagnosed with oral cancer in the United States each year. Oral cancer can take form in any part of your mouth: lips, tongue, cheeks, and throat. Early symptoms of oral cancer in patients are having lumps or bleeding in your mouth, soreness of throat, and difficulty in chewing. Dentists diagnose oral cancer through a cancer screening exam, and treatments often include combinations of surgery, radiation therapy, chemotherapy, and drug therapy. However, treatment isn't a definite solution and can result in restricted mouth and jaw movement, voice change, and even weight loss.
If losing your teeth isn't too concerning for you, losing your heart might change your mind. The American Academy of Periodontology determined that the presence of periodontal disease almost doubled the reoccurrence of a coronary event in coronary heart disease patients. Bacteria spreading from the oral cavity into the bloodstream can also cause inflammation in the lining of the heart. This is known as endocarditis. In 2021, the American Heart Association determined that in the presence of poor oral hygiene and gingival disease, infective endocarditis is far more likely to develop from bacteria attributable to periodontal disease in daily activities rather than a dental procedure. Essentially, this life-threatening disease isn't some rare complication, but rather a consequence from just something as simple as brushing your teeth. So, we should practice good oral health habits so we can save more than just our teeth, but possibly our life.
So, how do we practice good oral hygiene? Well, brush your teeth twice a day and floss in between your teeth to avoid the formation of dental plaque. Brushing your teeth is most beneficial if your toothpaste contains fluoride, because the American Dental Association calls fluoride nature's cavity fighter. But we know that just having people buy and use toothpaste does not solve the problem of oral hygiene in America. That's why I talked to the social experiment participants to see what they learned and how we as a community can help improve oral health.
Wow, I am in shock right now. I didn't know that being careless about something this simple as brushing your teeth can put the rest of your body's health at risk.
Yeah, we thought that people would be unaware of this information. That's why we wanted to conduct the social experiment in hopes of increasing knowledge for the public. What ideas do you have to increase dental knowledge in the communities, and how can we help?
A lot of the information I get is from my pregnancy visits with my doctor. And so if doctors had a bigger social media presence, they could spread information to not just their patients, but the public as well, and that would be really helpful.
Most of the donations for the homeless are like food or clothing, which are really important, but after hearing about the importance of oral hygiene too, I think maybe if the community did drives with like toothpaste or floss or other hygiene products, it could really help with me taking better care of my oral health.
Okay. Those are some really great ideas. But did you know that dental schools offer procedures done by a student dentist with a licensed dentist supervising? This is a great option for those who are in need of reduced dental care. Dental visits are just as important as brushing your teeth every day.
As we have learned, oral health is much more than keeping your breath fresh. Remember,
Buy some paste, make haste, and your oral and overall health don't go to waste.